This is Brandy Brimhall with Chiropractic Compliance Solutions, and I am back again with another commonly asked help desk question. And this question states that Medicare is denying my claims as not medically necessary. So why could this be and what could I do? So let's go ahead and review this. The very first thing you want to do is double check your coding. You want to make sure that you've used appropriate CPT codes, modifiers, diagnosis. Make sure your diagnoses are in the proper order if your Medicare contractor requires a specific order for those. Does your Medicare contractor have a diagnosis list according to your LCD, which is a local coverage determination? If they do have a list of diagnoses, then you must adhere to that. So those are some things that you must check first. And with all of those things in order, if everything appears correct, then there are some other things that I can point you to evaluate with your practice and your coding documentation and billing just to determine what might be resulting in your medical necessity denials for Medicare. So the first thing is if your coding does appear correct and your practice is adhering to billing and policy guidelines according to Medicare, there are other key factors that may contribute or may cause the denial for medical necessity from Medicare. So let's take a look at what those are. A couple things to look for. Number one is box 14. Is it your box 14 too old or too aged that Medicare or the other payer has determined that there's not enough to support for medical necessity of treatment after this amount of time? So make sure that you evaluate box 14. A couple of things on this though, you absolutely do not want to update box 14 if it isn't warranted. So this isn't a box you should go, or any box, you shouldn't change, alter, or update anything that isn't appropriate and isn't applicable. So you want to make sure that you are following policy guidelines at all times when billing Medicare and any other payer. The next thing to look for is, are the diagnoses assigned to the claim adequately supporting the services rendered, and are they within your scope of practice? What I mean by are they adequately supporting your services rendered, if you're billing, for example, a 98941, a manipulation of 3 to 4 regions of the spine, you should have 3 to 4 regions of the spine diagnosed and appropriately pointed to that 98941 service. You want to make sure that you have adequate diagnosis on your claim to support all of the services rendered. Next is diagnosis pointing, and you want to make sure that your diagnoses assigned are properly pointed to the appropriate services. This is something that Medicare and other payers look at as well, so you want to make sure that you take time to make sure that you are appropriately pointing diagnosis. The next thing you can look for on your claims is your use of diagnosis. Have your selected diagnosis been used long-term, never updated, or never changed? This may indicate a lack of medical necessity. Possibly the patient should have been referred out by this point, or possibly the course of treatment should have been altered. So there are several assumptions that Medicare could make if this diagnosis use is long-term, and that's something that they would determine that medical necessity isn't warranted and deny your claims based upon that. And just again, another reminder, you must always use the most appropriate diagnosis describing the symptoms or condition. It's never appropriate to use particular codes, service codes, or diagnosis just for the purpose of getting paid. Everything that you use on your claim form must accurately be described in the documentation. And again, going back to that box 14, never just change things for the purpose of getting paid. Your documentation and claim forms should tell the same story. A couple of other things to consider is your short-term diagnosis. Are the diagnoses used considered short-term diagnosis by Medicare, and you have exceeded the soft cap for those selected diagnoses? This is information that's usually within your local Medicare LCD. The same thing applies for long-term diagnosis. Anytime you are overtreating by what Medicare would expect based upon the diagnosis you're using, and by overtreating I mean treating the patient longer than what would be considered necessary or statistically standard for those particular diagnoses, this is something that would warrant a medical necessity denial by Medicare. And if these happen, Medicare may consider this overtreating as I just described. They may also determine the lack of medical necessity due to the length of treatment per diagnosis, and they may determine the patient is preventative or maintenance care. They may determine the course of treatment should have changed, or the patient have been referred out, the patient should have been referred out. And of course, all of these things that I just mentioned are all reasons that a claim would result in a medical necessity denial by Medicare. Continuing on, you also want to consider the frequency or the lack thereof of your patient visits. And this includes that, well, first I want to share with you that Medicare may have been monitoring consistently, or they may have just evaluated the frequency and duration and the schedule of patient care, which is really easy to determine by your claim forms. An inconsistency in treatment schedule may result in a medical necessity denial. The same as an overfrequency of treatment schedule with no updates to box 14, the diagnosis, and other things of that nature may also result in the medical necessity denial. Again, just briefly sharing that disclaimer with you, you have to use the most appropriate and most consistent information and make sure that you're following those policy guidelines for billing, coding, and documentation. Maintenance type consistency may result in medical necessity denial. So for example, if you have a patient that's coming in once every 3 weeks or once every 4 weeks or once every 6 weeks, those types of treatment schedules are very common for maintenance type patients, and Medicare will take note of that fairly quickly and will begin to deny for medical necessity. The above bullets that I just reviewed with you also may be an indication of no treatment plan in place, which is required by Medicare, and the lack of that or insufficient information on a treatment plan will result in medical necessity denial if Medicare has reason to believe that this required element, such as the treatment plan, as well as any other required element of documentation, is either insufficient or missing completely. So moving on, those bullets that we just reviewed are all things that you can take note of and review in your own documentation and your own claims to determine why you may be receiving a medical necessity denial by Medicare and what you should do about it. A couple of other preventative steps I have for you here is the first thing I want to encourage you to do is visit compliantchiro.com. They have an online compliance training program, which is a comprehensive compliance training program which includes coding, billing, and documentation required elements, tips, training, and many other helpful resources to help make your documentation, coding, and billing systems more solid and at less risk for denials, especially denials that you can't appeal. So you want to make sure to take a look at that because this is very essential for your practice and is part of compliance. The next thing you might consider is a file review. It's actually required that these be conducted at a minimum of once per year anyway, but a file review is also a really critical element of risk management and provides confidence of your coding, billing, and documentation as well. In the event of records requests, it will empower practices. If you have a denial or when an appeal is warranted, you have a much better chance of winning an appeal or being able to appeal if you have all of those required elements in place and feel confident that you do. So again, just visit compliantchiro.com for information on the online compliance training, as well as the file review to determine how one or both of those particular services might be beneficial to your practice. And in closing, to learn more about chiropractic compliance solutions, just visit compliantchiro.com to learn more about the products and services that they have available.